And I'm a big fan of looking at telehealth and saying, you know what, hospitals, this wasn't something you had just invented. This has been around. Skype's been around since the 90s. This is more of a, well, I guess us being caught kind of with our pants down there, in my mind, was more of a payment model. There was no incentive to be prepared to provide access and to provide answers for people and to be able to collect and figure out what's going on and act on it quickly because the dollars didn't add up to certain CPT codes. And that's where I think the biggest failure of our health system was. And happy to hear your thoughts on that. But I want to bring that back to our conversation of Gyant and how, I love the mission of making care more accessible. So I'll turn the microphone back over to you and say, just based on kind of that little bombshell kind of football I lobbed out there, where did you guys come up with this idea and what are you seeing as far as market adoption and really can we make care more accessible within the current confines of payment systems?
Yeah, Chris,
that's a lot. That's a big question right there.
Chris, a lot to unpack there. I would say it's not a bombshell at all, not at all a controversial opinion. We have a healthcare system that, for the most part, rewards elective procedures or other things. It does not reward preparation. We had no capacity for surge capacity, so no hospital is keeping a bunch of beds and staffing available in case there's a pandemic so that they can open up more wards, right?
It's hard. Yeah, it's hard to model as a business. And we have a massively unhealthy population and very little personal accountability.
Yeah, I would agree with that as well. So I think, the public health conversation perhaps is we could spend the whole podcast talking about that. But
we're already off the charts here, Doc. So you know what?
I are aligned. I do think the business model of healthcare is not at all aligned with the public health of America, and it's a reckoning we have to come to in this country at some level. It's going to be hard to disentangle. But let me get to the meat of your question about Gyant and where we came from to try to at least address part of the problem. One of the issues that the pandemic uncovered was the great challenges with access to healthcare. Challenges with dropping and dwindling staffing of trained professionals in healthcare, whether you're talking about nurses, physicians, or the support staff that are also involved, and other clinicians. And you've also had the growth of digital technologies like telemedicine and other approaches to reach out to patients, and patients having different expectations today around how they can communicate with others, that communicate with their bank or their airline or with their loved ones or whatever through the handheld devices that they carry around with them every day. And so at Gyant, we've recognized that we're trying to help our health system and payer partners get into this next wave of how they interface with their consumers and their customers.